Welcome to the White Coat Guide presented by Dr. Shanza Jabeen. Have you ever heard a hospital announcement like Code Blue, Room 304, and wondered what it means? Today, we're decoding the secret language of hospital codes, revealing how these color-coded alerts save lives and keep hospitals running smoothly. Let's dive in. Let's begin with the most urgent and dramatic code in any hospital, Code Blue. This is the moment when every second truly counts, and the entire emergency team springs into action. The announcement of Code Blue sends a ripple of urgency through the hospital, signaling that a patient's life is hanging in the balance and immediate intervention is needed. When Code Blue is called, it means a patient is experiencing cardiac or respiratory arrest. In these critical moments, the heart or lungs have stopped working, and every second that passes without intervention decreases the patient's chance of survival. The atmosphere becomes tense, and the focus sharpens. Seconds matter more than ever. A highly trained, specialized team rushes to the scene, bringing with them a crash cart loaded with life-saving equipment. This cart contains a defibrillator to restart the heart, airway tools to help the patient breathe, and emergency medications that can make the difference between life and death. Each member of the team has a specific, well-practiced role. One person immediately begins chest compressions to keep blood flowing to vital organs. Another manages the patient's airway to ensure oxygen can reach the lungs, while another prepares and administers critical medications. Every action is deliberate and essential. The team leader stands at the head of the bed, orchestrating the response, giving clear instructions, and making rapid decisions. Their leadership keeps everyone focused and ensures that no step is missed in the fight to revive the patient. This is a high-stakes, coordinated effort, a true test of skill, training, and teamwork. Every member must trust each other and communicate flawlessly, because in these moments, there is no room for error. Code Blue represents the hospital's ultimate emergency response, a race against time where the goal is simple but profound, to bring a patient back from the brink and give them another chance at life. Code Red means fire. Staff follow the race protocol: rescue, alarm, confine, extinguish, or evacuate. Doors are closed to contain smoke and flames, and evacuation plans are set in motion if needed. Firefighters and trained staff act fast, prioritizing patient safety above all. Code Red is all about quick thinking and preparedness. Code Black signals a bomb threat or suspicious package. The goal: keep everyone safe and calm. Security and police coordinate a search, evacuate affected areas, and lock down the hospital if needed. Staff are trained to gather information and follow strict protocols. If a suspicious item is found, the bomb squad takes over. Code Black highlights the hidden security layers protecting hospitals. Code Pink is every parent's nightmare: an infant or child abduction. The hospital goes into immediate lockdown, all exits are secured. Staff search every area, watching for suspicious behavior. Maternity wards use electronic tags to prevent unauthorized removal of infants. Security and law enforcement respond within minutes. Thanks to these protocols, actual abductions are extremely rare. Code Pink shows how hospitals protect their most vulnerable. When you hear a code orange in a hospital, it signals a hazardous material spill. This could be chemical, biological, or even radiological in nature. These incidents are rare, but they can be extremely dangerous, not just for patients, but for staff and visitors as well. The hospital's response must be immediate and precise to prevent the spread of contamination and protect everyone inside. The affected area is quickly evacuated and sealed off to contain the hazard. Only specially trained staff are allowed to enter, equipped with hazmat kits and full protective gear. Their job is to assess the situation, contain the spill, and begin the cleanup process, all while minimizing risk to themselves and others. If the hazardous threat comes from outside the hospital, a decontamination zone is rapidly set up near the emergency room entrance. This area acts as a barrier, stopping contaminants from entering the main hospital building and keeping everyone inside safe. Patients and anyone exposed are thoroughly cleaned in these decontamination zones before they're allowed inside. This process is crucial to prevent the spread of hazardous substances and to ensure the hospital remains a safe environment for care. The hazmat team works together in full protective suits, communicating clearly and following strict protocols. Their teamwork and training are essential to keep the hospital community safe during these high-risk situations. Code Orange is a powerful reminder that hospitals are prepared for more than just medical emergencies. They're ready to handle the unexpected, keeping everyone safe no matter what comes through their doors. Code Yellow is a critical alert that signals a disaster or mass casualty event, such as a large accident, natural disaster, or other emergency that could overwhelm hospital resources. When this code is announced, it means the hospital must immediately shift into high gear to respond to an influx of patients and rapidly changing circumstances. The hospital activates its command center, where leaders coordinate every aspect of the response. Staff gather to review emergency plans, assign roles, and ensure everyone knows their responsibilities. Communication becomes constant and critical. Non-urgent procedures are postponed to free up space and resources, while extra staff are urgently called in to handle the expected surge. Every available bed is prepared, and supplies are checked and restocked. Triage begins right at the ambulance bay, where nurses and doctors quickly assess incoming patients, sorting them by the severity of their injuries to ensure the most critical receive care first. Every department, from surgery to radiology to housekeeping, works together seamlessly to maximize resources and provide the best possible care under pressure. Regular emergency drills and simulations ensure that when disaster strikes, the hospital's response is fast, coordinated, and effective, minimizing chaos and saving lives. Code Yellow is a powerful reminder that hospitals are vital lifelines in times of crisis, standing ready to protect and care for the community when it matters most. From Code Blue to Code Yellow, these color codes are more than jargon. They're life-saving commands. Behind each code is a team ready to act, protect, and heal. This secret language brings order to chaos and keeps patients safe. Thanks for watching the White Coat Guide with Dr. Shanza Jabeen. Stay curious, stay safe, and subscribe for more medical insights.